Mr. X, a 25-years-old Malay man, a primary school teacher, not married and living in a house with his 50-years-old mother. He has been diagnosed with chronic asthma since 6 years old. Since then, he has been living a lifestyle and environment which prevent conditions that may trigger his asthma attack with combination of medication prescribed by the doctor. In 2023, he was tested positive with COVID-19 and complained of some symptoms were present, which are cough, nasal congestion, mild shortness of breath and mild fever. Fortunately, his mother was tested negative and had no symptoms. He carried out a checkup and COVID-19 test at a hospital and was referred to a dietitian for counseling and nutritional management for COVID-19 with the presence of chronic asthma while self-quarantine at home, and because of mild symptoms and stable condition. Both he and his mother have completed 2 doses of COVID-19 vaccine and a booster since 2020.
Assalamualaikum, Mr. Afiq.
Waalaikumsalam. You may sit here. My name is Afiq, your dietitian for today's counseling session. Let me confirm again. Your name is Mr. Arif, right?
Yes, I am Mr. Arif.
Firstly, I would like to apologize because of the long wait here. And due to COVID-19, we are required to practice the SOP, to wear masks and have physical distancing. I'm so sorry about that.
No, it's okay. Don't feel bad about that.
I hope our session today will go smoothly. And if you cannot hear me clearly, you may interrupt, okay? To tell and remind me about it.
Alright, no worries.
Okay, Mr. Arif, do you know why you are referred to me by the doctor?
No, I'm not sure. But the doctor told me that I need to meet the dietitian for nutrition management due to my asthma disease with COVID-19 infection.
Okay, that's right. Do you know how asthma and COVID-19 related to each other?
I think both are associated with the breathing system. Is this correct?
Yeah, that's good, Mr. Arif. For an individual who has chronic asthma, they are at higher risk to develop severe symptoms of COVID-19 compared to those COVID-19 infected but they don't have asthma. The symptoms such as shortness of breath and cough are more dangerous among asthma patients who are infected with COVID-19. Is it clear, Mr. Arif?
Oh, I see. Does it mean non-asthma people who are infected with the virus are really warded in the hospital?
Actually, there was no difference in the hospitalization rates between the two groups. However, the length of hospital stay was longer if a person had asthma. According to the severity classification, the number of severe COVID-19 cases who showed severe clinical outcomes including ICU care, application of mechanical ventilation or ECMO, and death were higher in the asthma group. However, in your case, you are allowed to just have self-quarantine because of no severe symptoms and your conditions also stable. I'm so sorry to mention those. I didn't mean to scare you, Mr. Arif, but this is the current reality.
No, it's okay. It even makes me realize that I need to take this matter very seriously. At least I can prevent worse risks.
That's good, Mr. Arif. I like your positivity and openness in health. Here, I would like to suggest some nutritional recommendations in order to prevent severe symptoms of COVID-19, especially when you have asthma. Do you know that diet may protect us against the virus?
I heard about it from social media, but not that very sure. Wow, I'm getting more excited.
Alright, Mr. Arif. An appropriate and healthy diet is thought to be a protective factor against COVID-19. Vitamin C, D, and E, minerals, proteins, fiber, healthy fats such as short-chain fatty acids, and omega-3 may have a positive effect during COVID-19 infection and may help to improve the symptoms. All these nutrients improve the immune systems to prevent and cure infection.
Oh, I see. But I don't know what kind of food all that. Can you please teach me more about it?
Yeah, sure. It's my pleasure to inform you about that. Okay, fruit and vegetable consumption may reduce the risk of developing asthma. May I ask, do you eat fruit and vegetables?
I do eat some of it, but not really that consistent.
Oh, I see. What kind of fruits and vegetables that you may tolerate?
I think apples and oranges.
Wow, that's good, Mr. Arif. Apples and oranges are good sources with the benefit of reduced risk of developing asthma.
Oh, that's good though. Maybe after this I will eat more apples and oranges every day.
Yes, sure, Mr. Arif. You may consider to eat fruits 2 times every day. And you may start with those 2 fruits since you love them, right? Even better, you add vegetables 3 times every day in your meals.
Yeah, that's right. I agree with you.
In order to get more support for the immune system, we need to consume plant-based food and animal-based food, but in the right way based on the guidelines. Meat, fish, and chicken are good sources to get most of the nutrients that are required for our body to promote and support the immune system to fight the viruses such as COVID-19 and other bacterial infections.
Oh, how about the negative one? What should I avoid, especially due to COVID-19 infection with asthma?
Good question, Mr. Arif. High consumption of processed food together with a sedentary lifestyle may increase the cases of hypertension and diabetes, which are risk factors for developing heart diseases, eventually increasing the risk of COVID-19 infection. Other than good nutrition, a healthy lifestyle such as exercising is also good to improve symptoms of asthma and even COVID-19 infection.
Oh, really? This is the first time I heard about it. But isn't it dangerous for people with asthma to do exercise? I heard it everywhere, especially since I was a kid.
No, that's not true. Everyone must exercise, but in the right way. The dangerous one is when you do very heavy exercise that may worsen the symptoms of asthma, such as shortness of breath. People with asthma can safely participate in regular physical activity. You may do between 20 to 60 minutes of physical activity on 3 to 5 days per week. Physical activity has been shown to provide benefits to asthma and general health. It is associated with reduced wheeze, fewer asthma worsening, and fewer asthma-related emergency department visits. Exercise training may provide an improvement in quality of life for an asthma patient, improvement in lung function, and an additional 9 symptom-free days per month.
Whoa, good to hear about that. All this while, I've been avoiding exercise. But how can I do all that since I have to quarantine at home?
You may just walk within your house or bedroom because you live with your mom, right? Avoid cleaning, or you may wear a mask to do house cleaning because you may inhale dust, pollen, or else that may worsen the symptoms. For your information, exercise is also good in preventing the infection of COVID-19. It is because exercise or physical activity may help in boosting our immune system, thus helping to prevent infection. Exercise is also good for mental health, especially during the self-quarantine when you live alone, which may prevent issues such as anxiety and depression, maintenance of body weight, and the prevention and management of chronic disease. Alright, Mr. Arif, we have come to the end. So how about today's session? Do you get any ideas or opinions?
Honestly, it was a very good session since I got a lot of information and understood better. I understand the importance of having good nutrition and lifestyle in health, especially to support the immune system when infected with COVID-19 to prevent the infection.
Glad to hear that. I think that's all for today's session, and I hope you will recover soon from COVID-19. Stay safe and healthy. Enjoy your quarantine at home and do all the screenings such as monitor oxygen level using oximeters regularly, update your MySejahtera, and stay hydrated. Thank you for all your cooperation, Mr. Arif.
Welcome, Mr. Afiq. Thanks to you too for all the tips and advice. I will try to apply it and spread it to others too.
Before we end, here is the pamphlet that already summarizes all the discussion for today's session.
Alright, thank you, Mr. Afiq.